Cryptomenorrhea. Cryptomenorrhea is a periodic shedding of the endometrium and bleeding, but the menstrual blood fails to come out from the genital tract due to obstruction in the passage. Causes of cryptomenorrhea. The first one is congenital. Under this, we have imperforate hymen, transverse vaginal septum, and atresia of the upper third of the vagina and cervix. The second cause is acquired. Under acquired, we have stenosis of the cervix following amputation, deep cauterization and coniation, and secondary vaginal atresia following neglected and difficult vaginal delivery. Pathology of cryptomenorrhea. There is only accumulation of blood in the uterine cavity resulting in hematometra. In neglected cases, the blood may enter the tubes whose femoral ends get blocked, resulting in distension of the tubes by blood, which is the hematosalpinx. Clinical features. Patients with the history of any of the etiological factors mentioned earlier complain of amenorrhea dated back from the events or periodic pain in the lower abdomen. Pelvic examination reveals the offending lesion either in the vagina or in the cervix. The uterus is symmetrically enlarged. Treatment includes simple dilatation of the cervix so as to drain the collected blood is enough. In case of secondary atresia of the vagina, reconstructive surgery is to be performed to maintain the patency.